Snoring. This could be a common sign of breathing disorders which happens during the sleep, and the commonest is the obstructive sleep apnea. Although snoring is a very common entity amongst the normal individual, but at some times it could be a risk to obstructive sleep apnea, which actually can raise our concerns regarding the health. So which snoring should be considered as significant? So if you are a snorer, though you are not the first person who will complain of the snorer, it's usually your bed partner who complains of snoring, and if that is associated with recurrent awakenings or that is occurring with choking sensations at night, you should be concerned. At times the patients usually wake up quite number of times, and that hampers the sleep hygiene, and that causes a delay in getting up in the morning. They are not able to concentrate in their work life is getting affected, they are unable to concentrate on their work. When these symptoms start appearing, I think that is the time that you should take this snoring as a sign a little more seriously, and you should get yourself evaluated for obstructive sleep apnea. Unfortunately, snoring is considered as a sign where people think that he is in deep sleep, but that not might be the case. Snoring, how often does it happen, is more important. Usually obstructive sleep apnea is a silent disease. If it goes uncorrected, it may be a risk factor for developing heart attacks. It could cause strokes and obesity and increased sugar levels in the body, which we call as diabetes. So if your partner or if your family member is snoring quite often or louder than normal, or if he is awakening at night, I think you need to get yourself checked for obstructive sleep apnea. You need to visit a physician. He lays you some questions, and depending upon which we decide whether we need to do a sleep study on you, and if that comes positive, it needs to be treated.